just walk through the quick reminder, and obviously we go into details with the documentation, but this is the documentation that you should be doing for the low-impact soft tissue spinal injury. So it is very specific for the low-impact soft tissue spinal injury case. Now, obviously, if you got other things going on, you will add to what we're talking about here. But this is kind of the bare minimum outline, again, that you want to be paying attention to with your documentation, which is what we call the high sensitivity testing. And we talk about, we put these into perspective, and also remember, what is the most important thing about your documentation is what is at MMI. That's the most important thing. What do you have at MMI? Okay. But let me just briefly go through this, and obviously we go through this in great detail. But you're starting with the vital signs, and I'll make a few comments about this, but blood pressure will have some degree. You'll have a variance in there. In the end report, so blood pressure and pulse could have some degree. Height's not. Weight could have. You have people pick up weight when they're sedentary, and that becomes an important biomarker. Pictures, you're not going to have much in the way of pictures if you do have scratches, bruises, or bumps. It's a low-impact injury, number one, but also we typically don't see patients right after the injury. So scratches, bruises, and bumps are typically gone. We do the physical examination, structural examination. Every chiropractor has a different way of doing their own structural analysis. And again, it's not real important. It's just supportive. So we'd easily just say any of these biomarkers are supportive, and in no way are they like really important, but they're supportive. And then, but the basic biomarkers to look at are head tilt, head rotation, shoulder high, shoulder blade elevated, shoulder blade protruding, ribs rotating, spinal curves, hips level, arches, leg length, or guarding. Those are the most common structural factors to evaluate. And remember, any of those categories would just be supportive, secondary supportive at MMI. And then, of course, palpation, that is important. We go into that in detail. The three categories you always have to evaluate and document and quantify: tenderness, muscle spasms, and joint fixation. And we cover these in detail. And then, of course, range of motion. We look at active range of motion and passive range of motion with overpressure, and we have it quantified. And we talk about muscle strength, especially what's called high sensitivity muscle strength analysis. And then there's the neurological reflexes, dermatomes, and cranial nerves. Typically, you won't have a whole lot of that done at MMI. You could have some variances at the initial exam, but almost never at MMI. And then you have the orthopedic tests. These are the most common orthopedic tests for the low-impact soft tissue spinal injury, from Soto Hall, cervical direct compression, cervical distraction, shoulder depression, foraminal compression, Adson's Wrights, Phelan's, Tennell's. And again, when I go through this, I cover in great detail not only how to do it, but how to quantify it. Lumbar exam is Kemp's, sitting vectorus, straight leg raise, Braggart's, Patrick Faber, SI compression. The extra test we do is Valsalva maneuver, Milgram's spinal percussion, and Mankoff's test. By the way, just so you know, Mankoff's test is the only objective orthopedic test. Mankoff's test. And it's basically getting their heart rate and then pressing on the painful area and testing their heart rate again. And the heart rate goes up if it's painful due to an autonomic reflex. That is 100% objective. And it says, yes, we've got pain here. And of course, the x-rays, the Davis series, that's the AP lateral flexion extension, APOM obliques, APOM left and right lateral bending, and the cervical left and right lateral bending. For the neck, for the lumbar, it's AP lateral left and right lateral flexion and the obliques. And again, I go into detail how to analyze these, how to quantify them, what specifically you're looking for, and what's the high and low probability findings. And then with the blood test, it's high C-reactive protein and sedimentation rate. And then the Dynarom, that's totally objective. And then the urine analysis is not relevant. You'll see that that's not relevant at all for the low impact soft tissue spinal injury. Relevant functional capacity indexes, those are the ones we like to use: the pain drawing portrait, the pain disability questionnaire, the health survey, the neck disability index, the oswestry low back pain, and the pain disability. Well, that's in there twice. Impairment indexes, loss of enjoyment of lifetime activities, duties under duress. Those are the categories overwhelmingly to document to support the soft tissue spinal injury. And what's important is not only being good at those, but remember it's a combination of all these other factors. Mechanism of injury, injury magnifiers, subjective findings, hybrid findings, objective findings. Those are the big, if you wanted to say the big five. Mechanism of injury, injury magnifiers, subjective, hybrid, and objective findings. That's the big five right there. And so we go into all of these categories and put it together. And that's how we come up with the MMI, the impairment, prognosis, and need for future care, and stop-logo offers. And obviously there's a lot more to it than this. This is the big outline. And then, of course, we go into each of these in detail of not only how to document it, how to quantify it, and how to give impairment ratings for it, and how to discuss it in terms of how it affects ADLs. Because remember, the two most important factors in all your documentation when it comes to the end are, do you have an impairment, and how does it restrict or limit ADLs? And so we go into that, which categories of spinal degeneration you're at, and then especially how does this problem that you have, that you can show from mechanism of injury, injury magnifier, subject to hybrid and objective, how and why does this problem cause pain, restrictions, and discomfort with ADLs, and why is it going to be a problem in the future? So that's the big picture of personal injury documentation, and obviously we go into great detail of how to connect all those dots.